So I'm looking at poster number 1159, which looked at IMRT, which, as you know, is a specialized form of radiation given in advance of a curative intent surgery in malignant mesothelioma. This trial, when I looked at this trial and I thought about, the patients that were actually enrolled in the trial, when we looked at the average age of the patients in the trial, it was much lower than the average age of a mesothelioma patient. We're talking about an age of 59 versus the average age, which is about 70. So we looked at a healthier cohort of patients. We also included patients who have biphasic and sarcomatoid mesothelioma, which traditionally are not referred on to surgery because surgery is thought maybe not to benefit these patients. And, based on some of the work that was done by Dr. Mark D. Perot up in Canada, he reported his results with the SMART trial. And he also had found in some of his earlier work that patients with sarcomatoid do not benefit by these, IMRT followed by surgery. Another criticism of the treatment is that, IMRT certainly can lead to pneumonitis and can, really cause a problem in some patients. And there could possibly be a delay from IMRT to surgery, which itself, poses additional risk. But then patients in the study were also, some patients had pleurectomies and some patients had extrapleural pneumonectomies. And I think that, we've advanced, in this disease, and the thought process really has led us to believe that it's much more preferable to do a pleurectomy versus an extrapleural pneumonectomy. We know that these surgeries are not curative. We know that these patients at some point will relapse. And it's my belief that patients have a better chance of fighting the disease with 2 intact lungs versus a patient who only has 1 left with recurrent disease. So I do think we need to, reconsider the type of surgery that's being offered. And, was there a decision to made during the surgery to switch from a pleurectomy decortication to an extrapleural pneumonectomy, or was that surgeon's choice? So I think there's a lot more that needs to be understood about this surgery.